to actually tell us what is the quality. So the underlying factor is this: the quality of the oocyte and the quality of the sperm. If the quality is good, the success can be achieved. But otherwise, we have a number of interventions to improve the quality in the form of drugs, in the form of the protocols that we use, injections that we use, and the technique, the selection of the sperm, the way we take the sperm, all these methods are there. But we cannot actually tell whether it is of good quality or not. We can only try to improve the quality to the maximum possible. This also, the PGT that we had just told you, is one of the methods to establish quality. But till you achieve a pregnancy and it progresses, we cannot be sure of it. And that is the reason why the success of IVF is about 40 to 50%. If you add on pre-genetic testing, it goes up to maybe about 60 to 70%. I hope that answers your question.
Ma'am, what was the cutoff for male? You said, I'm sorry.
55 years.
Males it is
Male,
55.
male is-
Females it is 50%.
So there's no hope for parents beyond 50 and 55.
It is, as I mentioned, we go according to the ART bill and we go by government recommendations. And it is also in patients' favor. It's for their own safety and their own health-related issues that we should not be trying beyond that age.
No, it's understood, ma'am. But then in the West, there are parents who have, gained motherhood at the age of 70 and now something.
Yeah, previously it used to happen even in India, but now with the ART bill and regulations, we don't advise.
The health conditions could be the same anywhere, whether it is West or East. So what prevents us from doing something?
The dog.
It's the government which has brought this ART bill. So we have to, like, as we follow all other rules and regulations, so we have to follow this also, and it is best interest of patients only. So, and also I feel when you are going to bring a child in this world, right, it's our responsibility to look after that child till the child becomes an adult, becomes properly educated, can stand on his feet and become independent. So we should also be taking this decision in right time. Right? So after 50 years, when you think of all those things, your health also will not be helping you to go through this pregnancy and all the related changes. And there are many complications which may happen in pregnancy even when somebody who's young is conceived. So it's like, they say it's a second birth for the lady. So I would also genuinely feel that we should take this decision at the right time. Should not delay it or should not just insist because we didn't have a child after 50 years that, I am ready to take all the rest. It doesn't make sense. If your child is going to have you for rest of his life as their idol and as their guiding light, then it makes sense to, go through all these things. So it's for the patient safety, it's for the better life of the child also that we are going to bring in this world.
Okay. Any other questions? Thank you, doctors, and thank you, media partners, for the insightful conversations that we just had. Now, I request the doctors to please take seats for there, and I would like to introduce two other speakers, Ms. Flora and Ms. Teja Bhargavi, who is dietitian and wellness consultant. Doctors, thank you for your time and the insightful knowledge that you have shared with us. It was really great experience. Thank you. So one and all, we have with us Miss Flora, who is the dietitian, and Miss Teja Bhargavi, who is the wellness consultant. So we'll be starting with Miss Flora, who would like to share a few words on how we have to, handle our diet, during all this phase and process. So, yeah, Miss Flora, over to you.
Good morning, all. This is dietitian Flora over here. Here I'm going to talk about why nutrition has been very important in your treatment as well. Right. From the treatment, when you start, diet is a number one where you have to maintain it like every day. Nutrients are very important, not only the supplements, the food, what you're eating, which gives you the nutrients, right, which has to store in your body, which will be beneficial for today, right? So it is something which gives you the quality and the quality of the breastfeeding. So number one is like balanced diet, where we always advise each and every patient, even for the man and the woman, like having a good balanced diet by adding the fruits and vegetables in your daily diet, good amount of protein, good amount of fiber-rich foods, and good amount of liquids in your diet. So now, after the delivery, we do add extra kilocalories in your diet. So always do not think about the weight loss now, because you want a good amount of the calorie-rich foods, good amount of the good fats, and the liquids, which has to be additionally added by adding up more extra 500 kilocalories per day. And always we do listening to many of our in-laws, from the in-laws would be like taking bread and a milk, bread and a coffee will increase your breastfeeding. But no, taking a good balanced diet, good amount of liquids can increase your breastfeeding and the quality wise and the quantity wise. This is how. And to be avoid fruits when you breastfeed your baby. No, it is not like that to be avoiding fruits. Fruits and vegetables, which are superfoods, mixed with n number of vitamins filled in that. So you have to include good amount of fruits and vegetables in your daily diet. Try to include good amount of a balanced diet, right? Adding up fruits every day, nuts every day, protein, either it would be from the non-veg or a vegetarian diet, or else you can include adding up like other vegetables, like 2 servings of vegetables, 2 servings of fruits. Adding 1 green leafy vegetable will increase your iron rich, and the calcium is very important. Like adding up milk and milk products every day can improve your breastfeeding, and you can think about your weight loss, and minimal moderate of exercise is necessary for every day, right? Almost like 20 minutes can be included of normal walk you can, but after 6 months you can think about the weight loss, but till then you can go with a healthy balanced diet. Thank you.
Thank you, Ms. Flora. Now, Ms. Teja Bhargavi, please share your quick insights and just give a brief snapshot about the wellness consultation.
Firstly, I congratulate all
You have
the
2 minutes.
Sure. So, firstly, I congratulate all the new parents, and as much as beautiful and joyous this whole news is, the whole pregnancy and childbirth can be, it can also bring you with a lot of exhaustion, physical exhaustion, mental exhaustion, and emotionally as well. So it's very important for the new parents to also take care of their mental health, to also take care of their emotional health. So I'll just quickly give you a couple of tips to do that. Make sure you take some time away from the baby as well, just to take care of yourself. Give yourself enough breaks. Have your own set of go-to people. It can be your partner, it can be your family member, it can be a friend. Make sure you have your own set of people to talk to, vent out, just share each and everything that you're going through. And connect with other parents as well who are going through this entire journey. And if at all there is any need, please reach out to therapy as well, to any psychologist that you think would be suitable for you. Because therapy would be a great space for you to vent out in a very safe space, and also learn to have a lot of coping mechanisms to deal with any stress or emotional aspects that you deal with. But all the very best for the upcoming journey to all these new parents and for their babies as
Thank
well.
you, Ms. Teja. Now we proceed on to the next event, that is the cake cutting. I request all the parents to please join us in this beautiful event. So we'll proceed with the cake cutting, and the next will be two of our beautiful parents are willing to share their experience